And I've already banged on about Stockport earlier in the chat, so I skipped that and would like to go first to our first slide. My name is Peter Beistold. I'm just setting the scene for Jennie, who's going to take over in a moment. So by most measures, Stockport is a pretty average town. We've got a few exceptions. We've got more looked after children than the average, and we've got more children attending good or outstanding schools. Our child development unit is a mixed setup which looks after all types of disability, so not just the autism diagnostic process, but it's been embedded for a long time. And proud to say that we've basically got a consolidated year-on-year progress for several years. If I could have the next slide, please. So it started off with a large number of our therapists being ADOS trained together. And we have, since 2003, been running a setup where we've been diagnosing using the ADOS and a formalized questionnaire, the ADI, with one pediatrician and one therapist. Now, many people might think that's a bit of luxury provision to have a pediatrician for each diagnosis, but I find it invaluable because we are the ones who follow on and give continuity. And at the moment, I'm seeing off my cohort from 2006, 2007 into college or even universities. So there is something to be said for having been there right from the beginning. And I think it gives me a lot of satisfaction and closure as well. We've inherited a historical child development unit system that is hub-based, meaning that we have all therapists together in a hospital setting. We also have a cut-off because we're only commissioned till school start, which means by the September the child has turned 4, we need to hand on the care, which certainly puts a certain ceiling on our assessment process. So we have to have come to a conclusion for all cases by a set date, which always gives us a very mad rush. We originally set up the system by the best evidence we had back in 2003, and we looked at statistics that said 1 in 2,000 cases have autism, and there used to be 1 in 250 for autistic spectrum as a number, which, if you look at the 3,000 births we've got, would make for about 20 to 30 assessments. And we assumed that we couldn't diagnose the Asperger's or high-functioning cases preschool anyway. Could I have the next slide, please? So that's how our projections turned out. And I'm sure many providers of early years diagnosis will have seen a similar pattern. Now, what's changed in 2012-13? It's not that we've got all of a sudden explosion in cases. What happened is that the ADOS 1 was replaced by the ADOS 2, and that was aligned with new diagnostic criteria for the DSM-5, which basically looks at a different set rather than the classical autistic triad. And we're certainly capturing a lot more cases since then. We have also cycled back a bit in our initial assumptions. We couldn't capture high-functioning cases of autistic children. And there's no up-to-date numbers for this year because we're not quite sure how we're going to come out of COVID lockdown, but we're trying our best to adjust our diagnostic criteria as we can. Could I have my final slide, please? I also want to tell about how we slid into PACTs, having an established assessment system. So we were lucky enough that we had one of the key researchers of the original PACT studies in our team. And we had a large number of therapists trained up for the original PACT study. So it was really interesting to hear from Dr. Paul Wilson how one should do commissioning and how one should collect the evidence and bring it to the commissioners and make a business case. Unfortunately, we did none of that. We had a trained up body of professionals. We went to our commissioner, said, that's amazing, that's exactly what we need. Use it or lose it. And that's pretty much how we slid into a business case for providing PACTs in the early stages. We have actually been using PACTs continuously since the data collection for the study and not waited for the evidence to come through. And it served us quite well so far. And I think with that, I'm going to hand over to Jennie. Thank you very much.
Hi, I'm Jennie Corkwood. We're just trying to socially distance as we present. So at the moment, our current PACT service has 7 speech and language therapists who are trained to level 2. That equates to a whole-time equivalent of 3.2 speech and language therapists who are all able to use PACT. And in terms of the use of PACT, how we split our days, each therapist offers about half a day or a full day for every 2 days that they work, and that depends on their caseload. Obviously, they have other commitments. We don't all carry caseload just for social communication. It works out approximately 30 33 sessions per week overall that are carried out for PACT sessions in Stockport CDU. And we're very lucky, we do have 2 speech and language therapists who are PACT trainers and supervisors, which means that every 6 to 12 months we are able to have some formal supervision. We have a lot of those chats in the office, the kind of, I've just seen this family, this worked well, this didn't work so well, and that's been really helpful for us. I think, as Peter mentioned, we've been very lucky to have the PACT set up in the form of support from commissioners, and managers have been ready to include PACT into the pathways, which has been essential, really. So for the next slide. Our current PACT service offers pre-diagnostic PACT. So when a child presents at an initial assessment with a speech and language therapist, and we identify that there are some social communication concerns, whether we think that child needs to go on to have a diagnosis of autism is irrelevant for us. We do pre-diagnostically put them onto our PACT pathway. So we do have some children who don't end up having a diagnosis of autism who do benefit from having PACT, and we've found that does support a lot of children with social communication difficulties. Obviously there's a prescribed 12 sessions from the study and from the guidance, but we have had to reduce this to 6 PACT sessions now. We have a waiting list to ensure what we hope is fair and timely access for children and families, but the reason that we've had to reduce it to 6 is unfortunately just due to capacity. As Peter demonstrated with his previous slides, we've had an increase in numbers of children referred, and the number of children who need to access PACT therefore has increased. So to manage that demand and that capacity, we've had to reduce this to 6. We find that it does work reasonably well, and we do try and offer a follow-up of 6 sessions as well. In between, families will also access review appointments where they can have what we class as a top-up or a maintenance session. And I think families really benefit from that, because sometimes in between they may feel de-skilled. I don't know if de-skilled is the right word, but they just maybe need a bit more guidance, and they just want to redo some of the sessions to get some more strategies because their child's developed, and they find that really helpful. So in terms of our service being clinic-based, it is that we work with parents in the clinic settings, but we do encourage them to share that information with nursery settings and education. All speech therapists will also do that when they go and do nursery visits. But all education settings and local services are aware of what we offer and of the PACT that we offer in CDU. So we do try and offer adapted strategies for our nurseries as well, so that they can continue some of that in the nursery setting. Obviously, there's been changes due to COVID, and this has provided some obstacles. So we can't provide face-to-face PACT in the clinic. We attempted initially to do 6 teletherapy sessions, so that was therapies provided where parents sent in videos, or we carried it out over a video session and we watched the video back. I think a lot of parents will agree that 6 sessions from home during coronavirus lockdown has not been possible for them, and we were getting a lot of feedback that parents were having to cancel sessions. They couldn't manage working from home with children at home and doing that many therapy sessions on top on a fortnightly basis. So we listened to that and we have adapted it again. So we're now down to 3 fortnightly sessions. We say fortnightly, but it might slightly differ depending on parent need. And we'll provide video or teletherapy. And the focus of that, the format has changed slightly. So we focused around discussion for the parents' thoughts and feelings and their understanding of their child's communication, because that really is the essence of PACT. And so that 3-session format is then followed up with review sessions every sort of 6 to 12 weeks. Obviously, this is ongoing at the moment, and so far we've had some good feedback. It fits with parents' current expectations, with their current capabilities as part of lockdown, and their needs. And I think the fact that parents can make those videos anytime then to suit themselves, and then they can find a quiet space to come and do the session with us, that has been a bit of a benefit for us. So local opportunities, I think, as mentioned with the changes due to COVID, offering the stay-at-home video therapy has been a way of offering a bit more flexible therapy. So we're still finding our feet with that, but it has been quite useful to do that. And one of the big things is building rapport and relationships with parents, and that's always been a benefit of PACT for us. we feel like we get a really trusting, empowering relationship with parents. Hopefully they feel the same way. We have a lot of open discussions around autism, and that happens throughout the PACT sessions. So it becomes quite empowering for parents. And I think some families who value PACT have asked for more sessions, and they sometimes hopefully feel like it supports their diagnostic pathway, because we've had those discussions around autism all the way through, and we've looked at the child's progress and how the changes to the environment can support them. That helps parents to think about whether or not they want to take those steps towards diagnosis. In some circumstances, it has almost prevented the need for an ADOS. And by that, I mean that with the recent changes due to Corona, we're not able to carry out face-to-face ADOSs. So PACT families have been the families where we felt we know them well enough that we can start to inform decisions around diagnosis where we're not able to get in and see them face-to-face. So because we've got those really good relationships with families, we know those children really well, we're able to talk to them about diagnosis without having to be in that face-to-face ADOS situation. And a lot of professionals from other services have commented that they can tell who's had PACT, hopefully in a good way, but they often, I think they felt that parents feel a bit more sort of understanding and ready for things like diagnosis or discussions around autism, and that can be really useful for those parents who go on to decide that they may want an autism diagnosis for their child. Some of the speech therapists have, some of their testimonials are there. So we've found that we've got a lot more parents who are on that pathway that, for diagnosis, that they are more prepared, because we're offering it in a pre-diagnostic manner. So we have fewer parents that respond with surprise when the child gets a diagnosis, because we've discussed it all the way through. There's a lot more of that preparedness, and they've definitely been part of the process because it's been a discussion throughout the PACT therapy sessions. And our parents are champions of PACT. I think in a lot of cases it's well established in Stockport, and other professionals also champion PACT. Local challenges. Obviously every service has their challenges. Some of them are similar. So things around time and capacity are probably themes that crop up in other trusts as well. For us, we have 1 hour allocated sessions, and that's been a bit of an issue for us because really it should be 90 minutes, but obviously with capacity and the number of children that we have to see, it has reduced. And our capacity means that the waiting times have sometimes increased greater than we would have liked, but we do use our review sessions as I mentioned previously, maintenance PACT sessions as well. Equipment has been an issue for therapists as well as for parents, and I think for us there's been a little bit of a lack of equity since coronavirus, because there are some families that don't have access to the right equipment for watching videos back and doing some of that video teletherapy. So doing video calls with people on their phone is not ideal, but really we want to make sure that everybody gets a good service and everybody has access to PACT. So that lack of equity from equipment has been an issue for us, hopefully something we can resolve in future. Family or child readiness for therapy. It's not something we come up against often, but in some cases parents may not like being recorded, they may not like this style of therapy, or they maybe are just not quite ready for this style of therapy, but often we can overcome that and we'll talk to them, and that's where the discussion around parent expectations and communication comes into play. The challenge of being a clinic-based service, which hopefully has overcome since Corona, since we've been doing video teletherapy, is that in clinic children interact very differently and we don't always get an accurate view of the child. So the parents sometimes struggle to engage children in that way, and then we're not getting a true picture of the children. So when families are now working from home and doing videos from home, that seems a lot more effective to get that true picture of what families see at home. That last point around interpreters is something that we are very aware of at the moment in terms of equity and diversity, and I think it's important that we're aware of having a really good stock of interpreters who have a good understanding of PACT, because the impact for EAL families in terms of accessing PACT is huge. So having really good quality interpreters is pretty essential. In terms of local challenges, there's a couple of things there again. Views from speech and language therapists, and I think the issues are around time, having to fit the sessions into an hour, feeling a little rushed, feeling like it's watered down, although to some extent around discussion, I think families get more opportunities to discuss over the video teletherapy more recently. Main concerns seem to be around time, resources and caseload size, which is a common theme. For the next slide, the professional and managerial issues are, we have a great pride in our pathway, and as I mentioned, PACT fits really nicely with our autism pathway, building relationships, passing the onus onto parents as therapists, and for them to be embedding therapy throughout the day is really helpful. Offering an evidence-based intervention is really helpful for us. Some of the trusts in our area aren't doing this, although the Greater Manchester project that we've been hearing about today should hopefully rectify that, and it should be offered more widely. PACT is very person-centred, and it gives the family ownership of their child and the management of progress for them. It fits in with something that we work with here in Stockport called Care Aims by Kate Malcolm S, in terms of parent ownership of goals and progress, and that then resulting in better outcomes for the child and the family, and being able to maintain progress, which is really good. So family values, which I think is really important. A lot of parents want more sessions, which therapists often find, but I think PACT in particular, we find that parents want more sessions from us, and we get a lot of individual feedback. We try to listen to family views and be collaborative. It's really important for us to leave space for families to work with us and tell us what their priorities are, and I think PACT is very good. That's the strength of PACT, really. So future plans, it's a big one, really. We are trying to be proactive. We feel like we are providing a good service in some ways, but we can always be better. Lots of things are working. Obviously, we've got Corona at the moment, and we need to work around that too. But things that we've got planned for the future are more PACT in the community at home. So getting out there and making sure families have got access to video therapy services. Future video therapy services may help us with training childcare providers, so doing joint sessions with them so they can see what we're working on with the children without them having to come into clinic and be face to face. Developing effective outcome measures, which I think possibly Ben or somebody was talking about previously. This is something that we're keen to do. We do have individual feedback and testimonials, but we really need to think about follow-ups long term and demonstrating to people how effective PACT is for families. And possibly extending it into school services, which is a challenge for us given that we have over 4 providers into Stockport schools. That's across special schools, resource provisions. So it's not just NHS, it's other services too. And how we would provide that given the time commitment and the fact that a lot of their services are consultative, we need to work around that for the future. So in summary, I think it's working well in a lot of ways pre-diagnostically for us, but we can always do better. But I feel like a pre-diagnostic PACT for us has been very beneficial for parents, families and for our service. So thank you very much for watching. I hope you found that useful. I believe we may have a couple of questions.
And the socially safe distancing. We've got a few questions coming in through the chat, and the intro one from Anna is how many speech and language therapists?
So across the whole of Stockport, I think there's around 40 of us, but that doesn't equate to 40 full-time speech and language therapists. As I said in my previous slide, we actually have 5 speech and language therapists working here at the moment because 2 are on maternity leave, but that only equates to just over 3 full-time therapists in the complex needs early years unit. So we have the equivalent of just over 3 full-time therapists carrying out the PACT, and 1 or 2 that don't do PACT sessions. And then across the whole of Stockport, we obviously have a much bigger team.
So if I can just comment the question from Paul, I think I've been a little bit misunderstood. I don't think PACT is a problem with high functioning children. The problem is that we are in the early years, our diagnostic process is not reliable enough to pick up each and every case. And that overlaps with a bit what Vicky is asking as well. We're not trying to substitute early intervention with a diagnosis, but there are some children where the development normalizes enough that they don't benefit from an early years diagnosis. And there are quite a few children who could be diagnosed where we make a balanced decision not to diagnose, together with the families usually, because they're not impaired enough on a day-to-day basis. If they will be impaired enough in 10 years' time, that's the main reason why we keep following them up. That's usually through my colleagues and myself as pediatricians, that, as I said, I keep them till high school age, and with their new problems will then trigger the other pathway for later diagnosis. And I think there's not a misunderstanding. When we're not normally doing any diagnosis without an ADOS, it's currently just to cope with the corona delay. We can't put the process 6 months on hold and just wait for the school year to happen. We need to move on a little bit and give our diagnosis rather than just holding it all.